Good day, everybody. Welcome to the Aesthetic Medicine lecture on Botox, the famous one, the one everyone knows about. So, what is it? Botox is colloquial shorthand for botulinum toxin. It's a neurotoxic protein produced by the bacteria Clostridium botulinum. In controlled medical doses, a purified, sterilized version of the toxin is used to reduce muscle contraction, alter glandular secretion, improve the appearance of wrinkles, and modify facial balance and contour. It is probably the most commonly performed aesthetic procedure in the world. So, what was it initially developed for? Initially developed for blepharospasm, strabismus, and other neuromuscular disorders. Um, and aesthetic applications became a thing after people noticed, hey, this person's wrinkles look better after I've treated them with this thing. Yeah. For those of you who do not know, strabismus is essentially eye misalignment, where cross-eyed, you can say, where one eye is facing in a different direction to the other. And a blepharospasm is involuntary sort of eyelid contractions. For some people, it's mild sort of twitching, and others it is uh, involuntary squeezing and closing of the eyelid the whole time. So today, botulinum toxin is very commonly used in dermatology, plastic surgery, neurology, ophthalmology, pain medicine, aesthetic medicine, variety of uses. So how does it work? It inhibits acetylcholine release at the neuromuscular junction. It binds to your presynaptic cholinergic nerve terminals, which releases cleaves your snare proteins, which inhibits your vesicle fusion of acetylcholine, which means muscle contraction decreases. Essentially, it stops acetylcholine release, which causes muscle paralysis temporarily. Effects are reversal because that's just it. You get axonal sprouting and neuromuscular junction recovery, normal body things. So then we get serotypes, type A to type G. Type A is the most commonly used serotype, which is usually in our brand name Botox, but also used in Dysport, Xeomin. I'm not going to pronounce this last two. The formulation and units differ between the brands, so it's important to consult the manufacturer's manual for their specific vial. So what are we commonly treating? Dynamic and static wrinkles. Dynamic wrinkles are visible during movement, such as your crow's feet, frown lines, smile lines, that sort of thing. And static wrinkles are visible at rest, caused by muscle activity, collagen loss, and elastin degradation. Static wrinkles normally poorly respond to Botox alone. They often need fillers and other forms of collagen stimulation to be most effective. And again, just like our lipolysis injections, anatomy is important. Complications of our Botox are commonly due to poor anatomical knowledge, leading to poor injection placement, and then incorrect dosing and excessive diffusion of the product in the area of injection. So let's go through some muscles. Our frontalis muscle is one of the important ones. It's the one that elevates your eyebrows. If you look there on our Cleveland Clinic diagram on the right hand side, it's essentially the ones on your forehead. When they contract, they produce your forehead lines. Important to note, this is the only thing that elevates your brow. So if you overtreat it, i.e. too much Botox, you can cause a drooping lid, or sort of a sensation of a heavy forehead, sort of a permanent frown. Yeah, no one wants that. Then you get your glabellar complex, which is made of your corrugator supercilii, your procerus, and your depressor supercilii. Again, it's part of your brow area, but it's more for your more minute contractions of your brow and your lids. It's responsible for your vertical frown lines. Overtreatment can lead to asymmetry, sort of a static, frozen look of the face, no emotions, and it can cause eyelid drooping. And then we get our orbicularis oculi, i.e. the one around our eye. It's to form your, help your eyelids move. The typical treatment is that you want to enhance eye opening and improve the appearance of the lateral canthal line. But problems are you can get dry eye, lower lid laxity, sort of a reverse drooping eyelid where it droops down away from your eye instead of over your eye. And then smile asymmetry, because when someone genuinely smiles, their eyes close somewhat, and if they don't, it can make your smile look a bit funny on one side. Then your masseters, i.e. your chewing muscles, important for jaw closure. So over-treatment can normally cause a smile weakness, facial asymmetry, sort of a chewing inability, or easy fatigue. Treatment is used to reduce clenching and slim the appearance of the lower face. Then you get your mentalis muscle, which is for chin elevation and pouting. People normally have the little dimples, the bevel chin, usually want Botox there. But again, over-treatment can make it more difficult to speak, and it can make your lips also fumble as you are doing daily tasks. Then your platysma is part of your neck. It's responsible for your lower facial depression, i.e. pulling your head down, as well as neck tension. It's important for your jawline contouring, but improper technique can cause neck weakness, voice changes because it's close to your cords, as well as dysphagia, which is difficulty swallowing, or maybe even inability to swallow. Then your midface has a lot of muscles. Ideally avoid this area if you can. These sort of injection sites are more advanced and anatomically sensitive. As you can see, there's a few things there that they refer to in the literature. But just unless you are very, very confident, it is difficult to sort of get exactly right which muscle you're injecting into in the midface. So, principles. History is important. Assess previous Botox use, pregnancy or breastfeeding, previous reactions, allergies, expectations, if there's any history of neuromuscular disease. And then your absolute contraindications are active infection at the injection site, known allergies or hypersensitivities to Botox, or those with NMJ disorders. Yeah, you're just going to make it worse. Then your relative contraindications are pregnancy, breastfeeding, anticoagulation, like warfarin, and again, body dysmorphic disorders, the cosmetically obsessed, unrealistic expectations. So, typically, it arrives as a powder, your Botox, which is reconstituted with preservative-free saline, or your water for injection, quote unquote. Different clinicians and brands reconstitute it slightly differently. It's important to take into account your manufacturer's instructions, and then also what you're trying to achieve and where you're injecting, because outcome is influenced by dilution volume, your depth of the injection, and then of course the expected diffusion into the surrounding tissue and the dose. For injection, you need typically insulin syringes, 30 to 32 gauge needles, and you inject very small amounts, like a ml at a time, maximally, to help reduce the pain of a needle going into your face. You can, number one, do a slow injection technique, use topical anesthetic or even ice. Then onset and duration. It takes effect within 2 to 5 days, with a peak effect in 1 to 2 weeks, and lasts about 4 months on average, with people requiring top-ups. Our most common expected side effects are a little bit of erythema, some bruising, some swelling, tenderness, but it is usually self-limited and goes away quite quickly. Then, like we said earlier, injection technique. Eyelid ptosis is one of the most discussed complications. It's typically by diffusion into a muscle it's not supposed to go into, which can cause facial asymmetry and the drooping eyelid. Again, because Botox is not a permanent intervention, this ptosis is temporary. It's more common in a low injection placement and an excessive dose. Then brow ptosis, which is, again, paralysis of your frontalis muscle, more likely in those with the generally heavier brows. All the patients, so when injecting the forehead, try to aim for more conservative doses than the standard. Asymmetry is again caused by uneven muscle strength, unequal dosing, normal anatomical variation between people, and diffusion, which you cannot always predict. The way you manage asymmetry is you've already injected it, you can't take it out, so you wait a few weeks for it to reach its maximal effect, and then you do sort of selective touch-up dosings to, this edge there, that edge there, the other side there, to make it look more even. And then get your Spock brow sign, which is when your lateral frontalis muscle remains normal, but your central frontalis is weakened, so you get a quite excessive lateral brow arching. Smile dysfunction. After master treatment, perioral injections or DAO treatments can affect speech, drinking, expression. Because of the large amount of muscles in the lower and the mid face, advanced expertise is normally recommended. And then again, you can get dysphagia and neck weakness, normally with cervical treatments, especially in platysmal injections. Very rarely is it dangerous, but if diffusion occurs, if you develop dysphagia, it can become clinically significant in the way that you cannot eat, cannot speak properly, may not even be able to breathe properly. Immunogenicity and resistance. Repeated toxin exposure theoretically leads to antibody formation and a reduced clinical response. Reduced clinical response means more is needed to achieve the same effect, which is then when you end up with those celebrities who look not real anymore. Risk factors include large cumulative doses, getting a boosted dose too quickly, and very frequent treatments. True resistance is very uncommon in proper aesthetic dosing. So, beyond aesthetics, what do we use Botox for? Hyperhidrosis, which is essentially an involuntary excessive sweating disorder. It can inhibit your acetylcholine release in the sweat glands, which helps. It's very highly effective, so you sweat less or not at all. And there's the chronic migraines, cervical dystonia, myofascial pain, and those with the TMJ dysfunction. Botox injections are also quite important. Well, not important, they're very helpful. So what are our key concepts? Start conservatively. Anatomy is important to know. Assess your patient as a whole as the procedure is going on, as the weeks go by. Um, Facial balance is more important than eliminating the wrinkle. Overtreatment looks worse than undertreatment. So, important to have proper anatomical training, baseline photography, reliability and traceability of your product, good sterile technique, emergency preparedness, so your emergency drugs, adrenaline, and so on, as well as good documentation and clear consent. You should overpromise. Should avoid. Do not overpromise. Sorry, you should avoid overpromising sort of effects and avoid unrealistic marketing, as well as excessive pressure of, hey, you should come for a touch up. Hey, you should come for a touch up. Hey, you should come for a touch up. Remember, the patient is more important than your wallet. Yeah, Botox has revolutionized aesthetic medicine. It's a very nifty little thing, which, although effective and generally safe, does carry risks, like all treatments. So study it well, train it well, and always counsel your patients. Thank you for listening to the Botox lecture.